how did these both get involved with the, is it the symbiosis competition?
Mhm. Um, yeah, I ended up hearing about it because one of my last films, Freya, which was made in Vancouver as well, and found out yesterday we just won audience choice as well as best female director at the Vancouver Short Film Festival, so that was exciting. But that was screening at Imagine Science, and because of that, they sent out the same email that Ipek got, I believe, just talking about the competition. So my producer sent it to me, and I was like, yeah, sure, I'll submit. Like, we'll see what happens. And then through that series of events, like a few days, they gave us information about a week or so or whenever before the competition about other participants, and so that we could put in, you know, our choices. And Ipek was my first choice because it was only at that point that I saw that she does work around endometriosis. And I was like, no way, because I was diagnosed myself in 2016. And since then, it's been a dream of mine to make a film about it. So yeah, and then the night of the competition, they, you know, revealed, the night of the first day of the competition, they revealed who partners were. And so it's pretty exciting.
Well then, Camille, before you met Ipek, you already knew what type of film, what subject you wanted to cover?
Well, no, because, well, I was thinking, like, no, we just don't know.
Okay.
So it's really interesting because I was trying to crew up on my side because I figured, okay, if I'm coming to it as the filmmaker, like I knew that we would, you know, whoever I'd be partnered with, we would both be filmmakers together, regardless of what their previous experience was. But I knew that I should try to prep as much as I can. Like, I'm sorry, my cats are going crazy behind me. I knew that I should try to prep as much as I can. So I was trying to crew up in Vancouver with the caveat of, oh, but also, like, on Thursday when I find out, I may not need you at all. And people were like, oh, so what's it going to be about? And I'm like, I don't know. And they'd get so like I could pretty much differentiate who I knew was going to be on the project from their faces at that point, because it would either be like complete dread and terror, or it would be like, oh, this is really exciting, yeah, I can't wait to do this. And so Tanya Jade was our DP, and she was, I think, maybe the one person who was like, this is so exciting, scary but exciting. And yeah, so all I knew on my side was like, okay, let me try to prep people as much as I can and get a team together so we can hit the ground running. But I did want to make sure that that it was a true partnership and I wasn't just taking over what was being made. So I told everybody, but I don't know if we're going to need you until Thursday.
Oh, geez.
Yeah.
Yeah.
So,
well, obviously you found the right people because it turned out to be a terrific film.
Yeah,
And
yeah.
So thank goodness you did find the, enough of the right kind of people to work on the project. And Ipek, how difficult is this for you to take time out of your, I guess, your practice? You're a working doctor.
Yeah, so I'm a research scientist at Columbia University. I do work full time. It has been, thanks to Camille, it has been smooth. I think, credit is due to Camille. Like, it's really thanks to her that we make it work. She's very nice with, you know, when we're scheduling things, she was, let's see if if I can make these times and everything. So thank you, Camille. I should take this moment to thank you one more time. So,
oh, you're welcome.
But the other part is because it is this film, and you know, the themes that we cover in this collaboration are so central to my work anyway. It is very organic. Like, I almost don't feel as though I'm switching, you know, like I don't feel like I'm wearing a researcher hat in the day and then during the day and then putting on my filmmaker hat in the evening, because it's the same themes. Like, when I'm writing a grant, I'll, you know, send Camille a message like, so, like, what do you think of this, you know, XYZ, or something, that a discussion that we have will inspire something that I'm working on at work. So it is, they do crisscross really, really nicely in that sense.
Mm-hmm. And the subject of, I was fascinated by the subject that there isn't a lot of work being done to find a cure for endometriosis.
No, it's like, And it's really interesting too from the patient perspective. Like I had a conversation with my surgeon. I've had 2 surgeries so far. The last one was December 2019, so just over a year ago. And I had a discussion with my surgeon recently, and I brought that up to her. I was like, "Look, I get it. There aren't great options, et cetera, et cetera." And then she was like, "What do you mean? I think there are wonderful options." And this was right after she told me that my next option was to go on even stronger meds when I told her that they were wreaking havoc on my body, or have a hysterectomy. And she kind of said it like, your choice, like you choose, let me know.
Hmm.
And then right after that, she was like, what do you mean? They're great options. And so that to me was especially indicative of what the problem is, specifically like what it is. And it's all mindset and mentality and access, but we can't have access until we shift our mindset around, what needs to be done. And how important it is, because something that we've talked a lot about in this whole process is that, like, it's not, when it comes to chronic illnesses specifically, it's not just about like finding a way to live, to survive. It's about, living fully, or trying to find that solution to live fully. But that's why things get pushed to the sideline a lot. Yeah. Because it's like, well, you're not dead, so
Yeah.
you're okay, right?
That's a horrible way to adapt that thinking, I think, especially coming from a doctor, where they think they don't determine the quality of life that a person is left with, when you're dealing with constant pain and discomfort like that. Now, Ipek, you must be very informed on the funding research that goes into this as a scientist. And are there more changes that could help better find a cure for this?
So, well, one of the bottlenecks with that is we have very limited funding for endometriosis in general. It's treatment, trying to find a cure, self-management, anything with respect in general as a disease that doesn't get enough attention. So there's a lot of room for improvement. But I think as a researcher who does research on patient-oriented or patient self-management of their health and their disease, I'm a big proponent of not just, okay, do you have a problem in this organ? Okay, let's remove the organ, or like let's medicate until you don't feel that pain in that organ. I'm very much a believer of self-management, self-regulation, so this holistic approach to not just remove the problematic organ, but okay, how can you live your best life, which is one way to define quality of life. Are you living the life you're living? Is it the life, is that your ideal life? Is that the life that you want to live? The closer those two things are, the closer you get to quality of life. That's really what it is. Because if you, paradoxically, if you look at the literature on symptomology and some of these, I guess, objective set of symptoms or other outcomes, they don't necessarily correlate with person's subjective evaluation of their condition. You can have someone who has a lot of pain, but they can report being very happy and very content and having a high quality of life. Usually those individuals have really good support systems. They have, there's people who support them, they're empathetic to their condition, etc. So like it's a multifaceted, multi-layered situation that we need to look at. So we really need a multi-perspective approach to correctly target the endometriosis, and it applies to other chronic conditions as well, to fully manage and to give these individuals a much better life that they deserve than they're currently getting. So we need more research funding so that we can investigate some of these open research questions. How can they self-manage? Because how often does a patient see a doctor? It's not very frequent, but how often does a patient have symptom? Every day. So they need a toolbox so that they can regulate these things on their own and not have to wait for surgery that's 6 months later.
Right. And is this condition still very hard to diagnose?
It is. I mean, the median, or I guess the average, I should say, is about 7 years. But if you look at the literature, you'll see 10 years. Yeah, there's a lot of doctor shopping until they get a diagnosis, and you need a surgery to have a formal official diagnosis. So you can't even have like a blood test So that the whole thing is invasive, very invasive, and
Yes.
very resource.
And those numbers are even skewed because there are a lot of doctors who say, oh, well, I suspect that you have endometriosis, but there's no point in finding out because there's no cure. So you may as well, like, there's no point in doing an invasive surgery. So here, just try these meds. So it's like, it's just this whole big, like, what's going on here? Because if you don't have all of the proper data, how can you find the source and how can you find the solution? Like, it's just, and we also can't deny that, hello, we're talking about women's healthcare here.
Mm-hmm.
And we're talking about something that historically has been more ignored than the counterpart. So
Yeah.
there's systemic issues for sure in terms of healthcare that's predominantly for women. We say AFAB, assigned female at birth, people are menstruating humans, because there are a lot of non-binary and trans endo warriors out there. But yeah, it's like that's a big part of the problem as well.
Mm-hmm. Is it largely due to the lack of research and funding on this? Is it largely due because it's a fairly new field of research?
No, I mean, if the first description or mention of endometriosis is sometime around 1900. I think it's like 1901 or something, that it was first, clinically described. This mysterious condition, it seems, blah, blah, blah. So it has been around for a long time, but it has been ignored. Part of the reason we think could be how it was portrayed in the literature historically, which was that it was this, white woman's disease. They're all well dressed, it's like the wealthy on career-driven woman's disease. So it was kind of labeled as that in the literature. And then, of course, like now that's not the belief. But what happens, over the decades, or what probably happened over the decades, is this is kind of fed to it being kind of dismissed, and maybe it's just menstrual pain that is, exaggerated, or that's maybe something else, as opposed to it's this independent etiology that we need to focus on and really try to understand and collect more data on. And now it's very recently, it is getting better, to be fair, but the research funding is lagging. So even if a physician is, better informed, if they're more aware and vigilant about this condition, they still need evidence so that they can practice, they can do evidence-based practice and help their patients. So that is where the other bottleneck happens. So again, we need a more systematic approach to how we're building data.
When you said that, I just imagined like a bottle with like 12 necks trying to get to source.
Yeah.
Like, because there's also something to be said about like ethics in research as well. There's a doctor in Italy in the past decade who did a study on women to find the correlation between a woman's general attractiveness and endometriosis. So he found a bunch of endometriosis patients and judged their attractiveness based on the size of their hips, the ratio of their boobs to their hips and their butts, and like all these things. Didn't tell any of them that's what it was for. And then coincidentally, it took about 7 years to have the study taken down and like debunked or whatever. And so like
There's some bad science out there then.
There's some bad science out there. And that's, I mean, I suppose that's with everything, but particularly when it comes to the fact that, from the outside, we're like, yeah, a lot of the problem has to do with this is a women's health issue and it's not being taken seriously. And then some dude goes and does something like that. It's like, come on, people. Like, get
It really puts more of a tarnish on the subject, on the research. Yeah. So has there been any breakthroughs, Ipek?
I wouldn't say breakthroughs, but what happened was last year, they increased, at least in the US, they increased the funding, or I guess they convinced, the federal budgets to increase funding for endometriosis a little bit. So it went from a whopping, what was it? From like $9 per person to $13 per person, or something funny like that. So like it's still very much down. It's like 35th from the bottom if you just list all the conditions, everything that's being funded at the federal level. But with respect to cure or a treatment, I would actually say again, this is very recent, and this is thanks to how the medical education is changing in the sense. Younger physicians have a more optimistic approach, or a better, I guess, more aware approach to this condition. And I think that is a starting point. If you have a physician who can see things a bit more comprehensively, who's more aware, who's not just thinking, oh, it doesn't exist in Black women, it's a white woman's disease. Once you kind of weed out those thoughts, I think we can make that'll help us make advances a little bit better. But in terms of medications and cure and treatment, no, it's I would say self-management approaches we will hopefully have a breakthrough with that soon, because that is a very low-hanging fruit. But I'm also saying that because that's my area of research, and we do have some evidence from pilot work, but we need I need more large-scale federal funding to kind of get a point where I can reach findings with the public.
Well, what do you hope most for people to walk away with this film? Is it mostly targeted toward people living with a condition, to provide hope that they're being heard?
So we want, we have multiple goals, but as an initial goal, we want this to be a conversation starter for people to start talking about this and raising awareness about some of these disconnects that pertains to endometriosis. We would love for everyone in the world to see this film. It's not just for people who live with this condition, but their family, their friends, their partners, physicians, non-physicians, just everyone. It's I think because a lot of these issues, it pertains to other chronic conditions, other chronic diseases as well. So there are definitely messages that can be applied. The idea of using direct patient input, going to the source, listening to the patient, taking that into account in a more systematic manner, that has applicability across many different domains and scenarios. So I think we want wide reach. And of course, if this can, lead to, Camille puts it really nicely. We want to change the system with this film. So maybe it'll initiate, like a domino effect it'll inspire some sort of change eventually down the road.
Mm-hmm.
Or like tomorrow. Come on, Ipek.
You're underselling it. Well,
that's why Ipek and I balance each other really well, because she has like the very pragmatic, fact-based, approach, and then I have like crazy approach, and then we meet in the middle, and then it's realistic.
Just about the incredible time frame that you had to make this film, it was quite a challenge. Did you know that going into the project that you only had 8 days?
Yeah.
I'm sure you wanna. Yeah, it gave us the ability to just move fast and to run with it. I was saying, I think yesterday, that it was a lot like improv, where you just have to say yes to things and find the best way to do it, rather than just sitting there. And because if you say no too much to ideas, then ideas from the team, then you're just sitting there and then you're like, oh shoot, it's due tomorrow, we haven't started. Mm-hmm. But what it did, actually, it really helped to give a very accurate idea of the endometriosis experience, even in its aesthetic. Because, for instance, Phoebe, who was our animator and co-producer, she's a really great animator, and all of her animation is hand-drawn. And so the approach that we took was the fastest, simplest approach. Do that. And so that was, and that's very much what the endometriosis experience is like. It's oh yeah, let's try this. And then sending you out of, the doctor's office, and you're like, cool, I'll catch up with you in 8 months. I hope it works. And so we were able to use that approach, which worked really, really well. And it actually added to the ridiculousness and the absurdity of it all with Andy, the angry uterus. And it's pretty funny, actually, because I think we had Phoebe started doing sketches on, I think the Thursday night is when we started. I think she started doing sketches on Friday. And by that point, I had already contacted my costume designer who I work with a lot, Karina Barros, and I called her in a frenzy and was like, Karina, we need a human-sized uterus costume. And she was like, okay, leave it in my hands. And then like the next night she dropped it off at my house, which is incredible. So we started to like do the animation around at the same time that the costume was being made, and Karina was sending us photos of what she was doing, and Phoebe was, you know, was implementing that into her sketches and such, so that the two Andys looked alike. But yeah, we just had to go like, you know, fast and heavy, and we completely changed not the story or the structure, but the vibe of the whole film. I think like 3 or 4 days in, it was like, okay, we're completely changing this right now. And so what we had to do, it didn't have anything to do with what we had already shot, because we started on the Thursday and we shot on the Saturday, but it had to do with like what we were saying and how we were saying it. So we basically like rewrote the script on the Wednesday or Thursday or something like that. No, it must have been the Tuesday. That's what it was. The infamous Tuesday, that maybe some of my team members still have nightmares about. I'm not sure. Uh-oh. But yeah, so it was a week, and it was, I think we all slept about like 3 hours a night that week. Mm-hmm. It was insane.
Yeah. There's a wealth of information that goes into this film, you know, but it's not overwhelming. So was it important to keep that balance?
Mm-hmm. Yeah. I think Ipek did a really good job of doing that.
Fantastic.
And like, yeah. Because she would give us snippets of info, and then we would be like, oh, so like this, and she'd be like, yeah, but you need to pare it down so it's accurate. And we're like, right, okay. So she would make sure that, you know, because in science and research, like, it really does matter what you're saying, because switching one word that could have a similar meaning but not the same meaning can change the entire meaning, and then that's just irresponsible, right? So Ipek was really great at that. And solid one-liners. She pulls out these really good snarky one-liners when you least expect it.
That's cool. Well, maybe there's maybe after you're finished, have you got your doctor's license now, or are you still continuing school?
So I'm a PhD, so I already have my degree. Okay. I'm on faculty at the Data Science Institute at Columbia. So as faculty, I do my research, and then I also direct. I do mentor and teach students. I direct a bunch of data science training and educational programs, and research mentoring programs. So I do have my hands in multiple research related buckets. So I do get to see like what all the other research going on around the world is. So yeah, we'll see where things go, and it's really nice. We're very excited for this Unstoppables at Slamdance. This idea of really focusing on disabilities, and I don't even like that word, like this. So it's such a human-made construct, like who decides what is disability? It's just this diverse ability. So it's I think hopefully one of my hopes for this program is that it'll kind of give a breadth of a lens through, like I guess like a view from the lens of individuals whose lenses we don't get to see through or hear from. So I think that will be that's one thing that I'm really excited about, like looking at these issues from a different perspective than just, oh, this thing that's like not so nice, but I'd rather not talk about it.
Mm-hmm. Mm-hmm. Yeah. I mean, if 1 out of every 10 women, a lot more needs to be done, and it's great that this film really shines a light on the subject to provide more awareness, and it also gives other people a voice and start a conversation, right? So terrific film. Where can the film be seen?
So it's going to be at Slamdance from the 12th to the 24th on demand. This year is the first year that they're doing very accessible passes. The whole theme of this year's festival is accessibility, and green light yourself is what the slogan is this year. So passes have gone down from $350 to $10 to access the entire festival. Okay. So yeah, people can go on. Slamdance.com is where you can buy a pass for $10, and you can find us in the Unstoppable program. And if you love us, you can vote audience choice, because that would give us an opportunity to make something like endometriosis more mainstream so that we can talk about it more and change the system. Yeah.
Mm-hmm. Well,
Oh, and you
you.
can also find us on, sorry, I was going to say, you can also find us on A Bloody Crisis at, on Instagram.
Okay.
Oh, I can't speak today. Okay. You can find us on Instagram, and our handle is at A Bloody Crisis.
Okay. Well, hey, very fitting. You know, at the end of the film, I get grossed out easy. And so I was watching that little video of the operation. Dr. Ipek, have you ever performed surgery on this condition? No?
No, I've not performed surgery, but I've through the process of trying to find the video for the credits, I ended up watching many hours of surgery. But of course, I mean, joking aside, I know from the literature how the surgery is well, but that's not something that I am. I personally, I guess, focus on I don't want to come across as like I'm an expert on endometriosis surgery. I just know the research aspects of it.
Mm-hmm.